Seniors, 4 dangerous vitamins you should never take, and 4 you should take daily. Are the vitamins you take really helping you or silently harming your body? In this helpful guide packed with senior health advice, we will explore 4 common vitamins that may quietly damage your liver, kidneys, heart, and nervous system after the age of 60, and reveal 4 essential vitamins that support memory, bone strength, and circulation. Whether you are taking supplements or simply trying to stay sharp and active, these senior health tips will help you make smarter and safer choices for your body. Based on real-life experience and solid science, this advice clears up confusion and focuses on what older adults truly need. Do not miss this life-changing health guidance. It can help protect your energy, independence, and peace of mind. Starting today. Vitamin A. When it comes to senior health, vitamin A is often seen as a familiar friend. Many people believe it improves eyesight, enhances skin, and boosts the immune system. Because of this, a lot of older adults continue taking vitamin A supplements every day, hoping to protect their health. But did you know that as we age, our bodies no longer process vitamin A the same way as before? Older adults often have trouble breaking down fat-soluble vitamins, and vitamin A is one of them. Instead of being gently processed and removed like in younger years, vitamin A starts to build up in the liver, an organ that may already be working less efficiently due to age or long-term medication use. When vitamin A levels get too high, the liver can become inflamed, fatigued, and silently damaged without you even realizing it. What is even more concerning is that high doses of vitamin A, especially the synthetic form known as retinol found in many supplements, can negatively affect your bones. It interferes with the function of vitamin D and reduces your ability to absorb calcium, 2 critical elements for keeping bones strong. As a result, bone density drops, and bones become fragile and more likely to break. A small misstep or a slight stumble on the stairs could lead to a broken hip, which often marks the beginning of a long recovery and loss of independence. A study published in the American Journal of Clinical Nutrition showed that older adults who took high doses of vitamin A for a long time had a significantly higher risk of osteoporosis than those who did not. Sadly, many people are unaware that the cause could be the vitamin they take every morning. A minor pain in the hip, a bruise that takes too long to heal, or a harmless fall all could be signs of long-term vitamin A buildup, a vitamin once thought to be safe. So, if you are currently using a multivitamin that contains retinol or taking high-dose vitamin A out of fear of poor vision or catching a cold, now may be the time to stop and reconsider that habit. With an aging body, more is not always better. Sometimes, being cautious and reducing the dose is the best way to protect yourself. Did you find this information helpful? If yes, feel free to leave a comment and share your thoughts. And do not go anywhere just yet. There is more important information coming up next. 2. Vitamin E. If you have ever heard that vitamin E is a miracle anti-aging vitamin, you are not alone. For years, vitamin E has been promoted as a powerful antioxidant that helps slow aging, prevent heart disease, and even protect against cancer. With promises like that, many older adults have trusted vitamin E as an essential part of their daily routine. But did you know that just 1 high dose of vitamin E each day could pose a serious risk to your brain and even your life? Vitamin E has a mild blood-thinning effect, which may be helpful in certain situations. However, this becomes a serious concern if you are already taking blood-thinning medications or aspirin, which are very common among older adults for heart-related conditions. When combined, the blood's ability to clot may become too weak, and the result could be internal bleeding, especially bleeding in the brain. Studies have shown that people who take more than 400 international units of vitamin E per day are at a higher risk of experiencing brain hemorrhage, also known as hemorrhagic stroke. What makes this dangerous is how sudden and silent it can be, often with no warning at all. When it happens, the results are severe paralysis, memory loss, or even death, and most families do not understand what went wrong. They would never suspect that a simple bottle of vitamin E, used regularly in hopes of protecting the heart or skin, could lead to such a serious problem. In addition, older adults usually have more sensitive bodies, and their circulatory systems are more fragile. Even a small internal bleed can place dangerous pressure on the brain or other tissues. Everything happens quietly, with few clear signs until it is too late. This is not meant to scare you, but to remind you that even natural-sounding substances can become harmful if used in the wrong way. If you are taking high-dose vitamin E, or using several products that contain it, it is wise to speak with your doctor. For older adults, balance is more important than high doses. And if you believe that vitamins are helping you stay mentally sharp, be careful because the next vitamin might be quietly damaging your nervous system. 3. Vitamin B6. Vitamin B6 has long been praised as a key nutrient for memory, mood, and energy. Many older adults turn to B6 hoping it will fight fatigue, sharpen a foggy mind, or simply because it is included in most multivitamins. However, the truth is that an aging body no longer handles vitamin B6 the same way it did in younger years. When B6 intake exceeds the recommended amount, instead of being easily removed from the body as many assume, it begins to build up in the bloodstream. And this buildup becomes the starting point of a serious problem damage to the peripheral nerves. Studies show that taking high doses of vitamin B6 for a long time, sometimes just over 100 milligrams per day, can lead to a condition called sensory neuropathy. This is where nerves in the hands, feet, fingers, and toes gradually lose their ability to feel and function. At first, you might feel a slight tingling in your fingers, a mild numbness under the soles of your feet, or a bit of unsteadiness while walking. You might think it is just age, but in reality, these are the early warning signs that your nervous system is being quietly damaged. If not caught in time, this condition can take away your balance, weaken your muscles, make walking difficult, and even turn simple tasks like buttoning a shirt into a real struggle. Even more concerning, many people do not realize they are getting vitamin B6 from multiple sources at once: multivitamins, energy drinks, brain supplements, and memory boosters. This overlap causes the total B6 in the body to increase every day without the person ever noticing. And once nerve damage has occurred, it is very difficult to reverse. Remember, what you want is clarity and strength, not numbness and loss of control. If you are taking vitamin B6 in any form, check the dosage. Do not let an innocent-looking vitamin steal your ability to stand tall and live independently. Next, we will look at a very familiar vitamin that is often used to boost immunity, but might be slowly straining your kidneys every single day without you realizing it. 4. Vitamin C. No one can deny the important role of vitamin C in supporting the immune system. For a long time, it has been seen as a protective shield whenever we feel tired, have a runny nose, or a sore throat. Many older adults take vitamin C daily, believing it will help them avoid colds and infections. But behind the harmless appearance of those fizzy tablets or orange-flavored chewables lies a hidden risk that not many people notice. When taken in high doses, more than 1,000 milligrams per day, vitamin C does more than just support immunity. Inside the body, it begins to transform into a substance called oxalate. Oxalate can bind with calcium in the urinary tract, forming sharp crystals known as calcium oxalate stones, one of the most common causes of kidney stones. For older adults, whose kidney function may already be declining with age, this risk becomes even higher. You may feel a dull ache in your lower back, painful urination, or simply discomfort while going to the bathroom. In many cases, these symptoms are easily mistaken for urinary tract infections or dehydration, but in reality, they could be signs that your kidneys are overloaded by the very vitamin you thought was protecting you. If you have ever experienced kidney stone pain, you know it is not just an ordinary ache. It feels like a sharp blade cutting through your body from the inside. Even worse, damage from kidney stones can linger. It can weaken kidney function, interfere with how you take other medications, and even lead to serious complications if not treated early. And the saddest part is that it may all begin with a habit that seems harmless, taking too much vitamin C every day. So, if you are regularly using high-dose vitamin C tablets or taking multiple supplements that contain vitamin C, now is the time to take a closer look at that routine. After the age of 60, your body needs gentleness, accuracy, and balance. Do not let the desire to strengthen your immune system accidentally harm one of your most important organs, your kidneys. 1. Vitamin D. Imagine standing under the early morning sun, soft light touching your shoulders, fresh air filling your lungs, and a gentle feeling of calm rising inside your chest. This is not just a pleasant moment, it is the time your body quietly absorbs one of the most important nutrients of all, vitamin D. Vitamin D does not create an instant feeling like caffeine or sugar, but without it, you may slowly begin to feel tired, achy in your bones, mentally sluggish, and more prone to illness over time. The worrying part is that most older adults today are deficient in this vital vitamin without knowing it. As we age, our skin becomes thinner, we spend less time in sunlight, and our liver and kidneys do not work as efficiently, all of which reduce the body's ability to naturally produce vitamin D. Vitamin D is essential for absorbing calcium, maintaining strong bone density, and preventing osteoporosis, a silent disease that can change your life with just one small fall. Research from Harvard University shows that older adults with low vitamin D levels are more than twice as likely to suffer a hip fracture compared to those with healthy levels. Vitamin D also works like a gatekeeper for the immune system, helping the body defend against infections, autoimmune diseases, and even some types of cancer. Many people ask, if I eat well, do I still need to supplement? The answer is possibly, and in many cases, yes, even with a balanced diet. If you do not get regular sun exposure, live in a place with long winters, or are over 65, your chance of vitamin D deficiency is very high. So, how should you supplement it correctly? For older adults, the recommended daily amount ranges from 800 to 1,000 international units, taken as a capsule or liquid drops. In addition, just 15 minutes of gentle morning sun each day before it becomes too intense can help your body naturally produce this precious vitamin. What matters most is consistency, moderation, and not overdoing it. Think of vitamin D as a strong foundation. You do not see it, but it supports your entire health from within. When you supplement correctly, you may feel more stable, clearer in thought, and more confident with each step you take. We have now talked about bones and the immune system. Next, let us look deeper into memory, alertness, and the mental energy you need each day. The next vitamin may be the key to regaining the clarity you thought you had lost long ago. 2. Vitamin B12. Have you ever walked into a room and suddenly forgotten what you were planning to do? Or while telling a story, a familiar word just slips away from your mind. You are not alone. Many people over the age of 60 have experienced this feeling, and most believe it is simply a normal part of aging. But the truth is more complex. A major cause of this problem may actually be a lack of vitamin B12, one of the most common and easiest to fix deficiencies that affect memory and energy in older adults. Vitamin B12 plays an essential role in making red blood cells, maintaining nerve function, and protecting brain structure. However, as we get older, the stomach produces less acid, making it harder to absorb B12 from food even if you eat well. As a result, even though you might be eating eggs, meat, or dairy foods rich in B12, your body may not absorb enough. This leads to a slow decline in how well your nerve cells work. The early signs of B12 deficiency are easy to miss: fatigue, forgetfulness, trouble focusing, poor sleep, or feeling like you are living in a fog. But if left untreated, this can lead to permanent nerve damage, poor balance, mild depression, or serious memory loss. One study published in the Journal of Clinical Neurology found that older adults who took proper vitamin B12 supplements showed clear improvements in remembering names, focusing while reading, and even regained mental flexibility in their thinking. The good news is that vitamin B12 is safe, effective, and easy to add to your routine. You can take it as a sublingual tablet that melts under your tongue, a regular pill, or an injection if your doctor recommends it. Common suggested doses range from 250 to 500 micrograms per day, depending on your health condition. For those with severe deficiency, doctors may suggest regular injections to ensure full absorption. The amazing part is that when your body gets enough B12, it is like turning the lights back on. You remember your grandchild's birthday, find the words you were looking for, and feel more like yourself just as you were years ago. If you have been blaming age for your forgetfulness, tiredness, or low mood, it may be time to check your vitamin B12 levels. What you really need may not be to put up with aging, but to restore the nutrients that help your brain work like it used to. Now that we have taken care of the mind, it is time to talk about the heart and circulation, the systems that keep every cell in your body alive and well. The next vitamin might be the missing link that helps you avoid artery damage without even knowing it. 3. Vitamin K2. Not many people have heard of vitamin K2. Some may even confuse it with vitamin K1, which is better known for helping blood clot properly. But vitamin K2 has a very different and quiet role, and without it, many older adults could face two of the biggest health threats in later life: osteoporosis and hardened arteries. By the time you reach your 60s, you may already be taking calcium and vitamin D to keep your bones strong and prevent fractures. However, research shows that without enough vitamin K2, the calcium you take in may not go to your bones at all. Instead, it can end up in the wrong places, like the walls of your arteries, where it may cause calcification, narrowing your blood vessels and increasing your risk of stroke or heart attack. This is where vitamin K2 becomes essential. It works like a smart traffic guide, sending calcium to where it is needed into your bones and teeth, and keeping it away from where it does not belong, like your blood vessels or soft tissues. Vitamin K2 activates a protein called osteocalcin, which helps calcium bind to bone tissue, and it also supports another protein called matrix GLA protein, or MGP, which prevents calcium from hardening your arteries. A study from Maastricht University in the Netherlands showed that older adults who ate a diet rich in vitamin K2 had lower rates of artery calcification, better bone density, and a lower risk of death from heart disease compared to those who lacked it. Vitamin K2 is not common in everyday foods, but it can be found in natto, a Japanese fermented soybean dish, aged cheeses, or some butter and eggs from grass-fed animals. However, to be sure you get enough, the easiest way is to take a K2 MK7 supplement. The suggested dose is usually between 90 to 180 micrograms per day, depending on your needs and doctor's advice. One special thing about vitamin K2 is that it works even better when taken together with vitamin D3 and magnesium. These three nutrients form a powerful team that protects your bones and blood vessels. If you are already taking calcium or vitamin D but have not paid attention to K2, this may be the missing link that helps you truly benefit from your supplements. Just imagine, instead of weak bones and arteries clogged with calcium, you could have a healthy circulatory system, strong bones, and confidence in every step you take, all by adding one little-known vitamin to your daily routine. After caring for your heart and bones, there is one more essential nutrient to talk about, one that plays a key role in muscle relaxation, deep sleep, and emotional balance. That nutrient is magnesium. 4. Magnesium. There are small discomforts in life that many older adults often accept as normal: a leg cramp at night, restlessness while trying to fall asleep, a racing heartbeat in the middle of the night, or simply feeling tired even after a full night's sleep. Many people quietly live with these symptoms, not realizing their bodies might be missing a very important mineral: magnesium. Magnesium is a vital mineral involved in over 300 biological processes in the body. It helps regulate blood pressure, maintain steady heartbeat rhythms, support nerve function, relax muscles, and balance blood sugar. In younger people, magnesium deficiency is less common, but after the age of 60, the risk increases due to lower absorption in the intestines, higher loss through urine from using diuretics or blood pressure medications, or from eating fewer leafy greens and seeds. One of the most common signs of magnesium deficiency is nighttime leg cramps, that sudden, painful tightening of the calf muscle that wakes you from sleep. Other signs include restlessness, mild anxiety, irregular heartbeat, ongoing fatigue, or difficulty falling into deep, restful sleep. These symptoms may seem unrelated, but in truth, many of them can be linked to low magnesium levels in the body. A study published in the European Journal of Clinical Nutrition showed that supplementing with magnesium in older adults significantly reduced muscle cramps, improved sleep quality, and slightly lowered blood pressure in people with a history of high blood pressure. The good news is that magnesium can be added easily through diet. Foods rich in magnesium include dark leafy greens, almonds, cashews, pumpkin seeds, soybeans, avocados, and whole grains, However, if your diet does not provide enough, or if you are taking medications that deplete magnesium, you may want to consider taking a daily supplement of 200 to 400 milligrams as advised by a healthcare provider. One of the most comforting things about magnesium is its gentle and calming effect. It does not overstimulate. It does not raise your heart rate. It simply brings your body back into a natural, peaceful balance. You feel more at ease, sleep more deeply, wake up with less fatigue, and those nighttime cramps slowly fade away. Magnesium does not produce instant results like caffeine or sugar, but with patience, you will feel the difference in every step, every night's sleep, and even in every breath. It is a gentle support that everyone deserves, especially as we enter the phase of life where the body needs more care and attention than ever before. Growing older does not have to mean a decline in health. It can be a new chapter one where you live more slowly, more deeply, and more wisely. The things you used to do in your youth may no longer suit your body now, but that does not mean you are weaker. On the contrary, you are entering a stage of life where every small decision can bring great impact, and choosing the right vitamins is one of those decisions. We have now explored 4 vitamins that should be avoided because they may quietly harm your liver, kidneys, nerves, and blood vessels, such as high doses of vitamin A, E, B6, and C. At the same time, you have discovered 4 essential nutrients that deserve a place in your daily routine to help support strong bones, sharp memory, healthy circulation, and emotional balance. These are vitamin D, B12, K2, and magnesium. What matters most is not how many supplements you take, but how well you understand what your body truly needs and where to begin. Sometimes, it can be as simple as a warm glass of water with vitamin D in the morning, a small magnesium tablet before bed, or stepping out to your balcony for a few minutes of sunshine. These small actions, repeated daily, can make a huge difference in your health and peace of mind. You do not need to change everything overnight. Just take one step. Choose one thing from this video that feels right for you and try it. After 1 week, 1 month, or 1 year, you may be surprised by the changes you feel. And now, I would love to hear your story. Which vitamin are you currently using from this list? Which one surprised you the most? Please feel free to share your thoughts in the comments. I am always happy to hear about your health journey. If you found today's information helpful, don't forget to click like and subscribe to this channel so you will not miss future videos. Each week, we will bring you gentle, easy-to-understand knowledge that empowers you to take better care of yourself with confidence and clarity. Wishing you health, peace, and strength in everything you do. And remember, every small decision you make today can become a beautiful gift to your future self. See you again.